Hello and welcome to our Nursing Hub channel, where experienced nurses teach the young generation of healthcare professionals. Today, we'll be discussing the different types of central venous catheters and their indications. The information provided in this presentation is for educational purposes only. While every effort has been made to ensure the accuracy and reliability of the content, it is not intended to replace professional medical advice or education. Nurses and student nurses are encouraged to consult their healthcare facilities' policies and procedures and work under the guidance of their healthcare team. A central venous catheter, also known as a central line or a central venous access device, is an indwelling device inserted into a vein of the central venous circulatory system. CVCs were once only used in critical care units, but its use has dramatically increased in various healthcare settings, now common in medical and surgical wards, and even in community environments, providing both short-term and long-term therapy needs. CVCs can be classified based on several factors, ranging from their appearance to how they are inserted and to how they are used. These factors include, but are not limited to, long-term versus short-term use, valved versus non-valved, single lumen versus multi-lumen, tunneled versus non-tunneled, cuffed versus non-cuffed. We will explore the different types and their classification in detail and compare their respective advantages and disadvantages. Long-term CVCs and short-term CVCs. Long-term CVCs are designed for extended use, lasting from weeks to years. Two common examples are peripherally inserted central catheters, known as PICCs with extended dwell time, and implanted port catheters, also known as port-a-caths. These long-term CVCs are the go-to choice for patients requiring prolonged intravenous antibiotics, long-term chemotherapy, or nutrition support. They offer reliable venous access, minimizing the need for repeated catheter insertions, which reduces patient discomfort and risks associated with multiple punctures. However, long-term CVCs are associated with a higher risk of infection due to their extended duration, and they require professional training for proper maintenance and care. On the other hand, short-term CVCs are intended for temporary use, typically lasting a few weeks or less. Common examples include non-tunneled CVCs for critical care, also known as percutaneous and non-cuffed CVCs. This type of CVC is advantageous in situations where patients require immediate central access in the intensive care unit or have short courses of intravenous therapy. They have a lower infection risk compared to long-term CVCs, as they are not in place for an extended period and are relatively easy to insert and remove. However, these catheters need to be replaced after a few weeks, which can be inconvenient for patients and require additional procedures. Moreover, they may cause vessel damage during insertion or removal. Valved CVC and non-valved CVC. Valved CVCs come equipped with built-in valves to prevent backflow and air embolism. Two examples of valved CVCs are valved PICCs and valved hemodialysis catheters. These valved options are beneficial for patients requiring frequent catheter access with reduced infection risk. Valve PICCs are often used when multiple medications or treatments need to be administered simultaneously. Valved hemodialysis catheters, on the other hand, are commonly employed in patients needing reliable and safe vascular access during hemodialysis sessions. The built-in valve in these catheters reduces the risk of blood reflux during manipulations and decreases the likelihood of air entering the vascular system. However, valved CVCs can be more challenging to flush and maintain due to the valve mechanism, and they typically come at a higher cost compared to non-valved catheters. Non-valved CVCs lack built-in valves and may require clamping during catheter manipulation. Common examples include non-valved PICCs and non-valved central lines. Non-valved PICCs are suitable for patients with short-term intravenous therapy needs where frequent catheter access is required. Non-valved central lines are often used in emergent situations for critically ill patients. Non-valved CVCs are easier to flush and maintain, and they're usually more cost-effective compared to valved CVCs. However, the absence of a built-in valve increases the risk of air embolism and blood reflux during manipulations, making them potentially less safe in certain scenarios. Tunneled and non-tunneled CVCs. Tunneled CVCs have a subcutaneous tunnel for reduced infection risk and improved stability. Examples include tunneled hemodialysis catheters and tunneled port catheters. Tunneled hemodialysis catheters are suitable for patients with end-stage renal disease requiring long-term dialysis. Tunneled port catheters are commonly used in patients undergoing prolonged chemotherapy or frequent blood draws. Tunneled CVCs offer lower infection risk compared to non-tunneled catheters, as the subcutaneous tunnel acts as a barrier to prevent bacteria from entering the bloodstream. Additionally, patients often find them more comfortable. However, the insertion of tunneled CVCs requires specialized training and expertise, which may limit their availability in certain healthcare settings. Non-tunneled CVCs, in contrast, are directly inserted into veins without a subcutaneous tunnel. Examples include non-tunneled central lines and non-tunneled hemodialysis catheters. These non-tunneled options are quick to insert, making them suitable for patients requiring urgent central venous access in the ICU or for temporary dialysis access in critically ill patients. However, they come with a higher risk of infection compared to tunneled catheters, as they lack the added barrier of a subcutaneous tunnel. Additionally, the direct insertion can increase the risk of catheter dislodgement. Single-lumen and multi-lumen CVCs. Single-lumen CVCs have a single channel, making them suitable for straightforward applications. Examples include single-lumen central lines and single-lumen hemodialysis catheters. Single-lumen central lines are used for patients requiring basic venous access for medications and fluids. Single-lumen hemodialysis catheters are used for patients requiring temporary dialysis access. These single-lumen options have a simpler design, which makes them less prone to clotting and potentially easier to insert. However, the limitation of having only one channel means that they cannot be used for simultaneous infusions of different medications. Multi-lumen CVCs, in contrast, have multiple lumens in a single catheter, allowing for simultaneous infusions or separate functions. Examples include double-lumen PICCs and triple-lumen central lines. These multi-lumen options provide greater versatility and the ability to administer multiple medications simultaneously, which is particularly useful in complex medical cases. However, the increased complexity of their design may lead to a higher risk of complications, such as catheter-related infections or malfunctions. They are beneficial for patients needing concurrent infusions, such as antibiotics and nutrition, or for critical care settings requiring multiple medications and frequent blood sampling. Cuffed versus non-cuffed catheters. Cuffed catheters have a cuff or collar to promote tissue ingrowth and stability, while non-cuffed catheters lack a cuff. Cuffed hemodialysis catheters are suitable for patients with recurrent catheter exchanges. Cuffed central lines are suitable for patients with long-term vascular access needs. Cuffed CVCs offer enhanced stability and reduce the risk of catheter migration, leading to fewer catheter malfunctions and improved patient comfort. However, the cuff may cause tissue irritation, and in some cases, it can lead to stenosis or narrowing of the vein over time. Non-cuffed catheters, on the other hand, are used in various situations when cuffing is not necessary. They are less complex in design and easier to manage. Peripherally inserted central catheters, or PICCs, are inserted peripherally and advance to a central vein. They come in single-lumen and double-lumen variations. These PICCs are suitable for patients requiring long-term intravenous therapy, such as those with chronic infections or in need of long-term antibiotic treatment. They offer a lower infection rate compared to other CVCs and have the advantage of being less invasive during insertion. Single-lumen PICCs are commonly used when patients require long-term intravenous therapy with a single medication. Double-lumen PICCs, on the other hand, are preferred when patients need multiple infusions simultaneously, such as concurrent antibiotics and nutrition. PICCs are associated with lower infection rates, making them suitable for patients requiring long-term venous access. However, they may not be suitable for patients with poor peripheral veins, as successful insertion requires a suitable vein. Port catheters, also known as implantable portacaths, are implanted under the skin and connected to a catheter in a central vein. These port catheters are commonly used in oncology patients requiring frequent chemotherapy over an extended period. They offer lower infection risk compared to external catheters as the port is placed under the skin. This not only improves patient comfort, but also allows patients to maintain a good quality of life during treatment. However, accessing and maintaining port catheters require specialized training, as the port needs to be accessed using a needle. Additionally, they are generally more expensive than other types of CVCs. To conclude, central venous catheters come in various types, each with its unique advantages and disadvantages. Understanding the different types of CVCs is essential for delivering safe and effective patient care. Selecting the appropriate CVC depends on the patient's clinical needs and the expected duration of therapy. Thank you for joining us on this educational journey. We hope you enjoyed the presentation. Join us next time as we discuss how to care for CVC patients with potential complications such as pulmonary embolism and thrombosis. If you have any suggestions for future content on Nursing Hub, please leave a comment. Don't forget to share, like, and subscribe.